So I'm just using the Vista Piezo, going just very lightly across those molars. And you can see it just adapts very well around the tooth structure. No trauma to the tissue, no trauma to the tooth. Quiet as it goes around, so I'm not having that loud, high-pitched shrill every time I work. Water irrigation is wonderful because I'm not getting that aerosol mist all around as you would with the Cavitron. It focuses in on the area that we're actually working on. Gives that delivery system right into the area really well. Very adaptable into those interproximals. I love that universal tip. The universal tip just is thin enough and works well in any area of the mouth without any issues. The grip alone on the actual piezo unit is perfect. There's no slippage. The other thing that I love about it is the fact that you can actually remove it and autoclave it, so therefore sterilization becomes a breeze with that, and you don't have to worry about any issues with infection control. But you can see that water just goes right into the area really well, dispensing all around and actually removing some deposit very, very gently. And patient doesn't feel any discomfort as I work. So far, so good? No discomfort?
Yeah.
Good. But definitely an improvement compared to Cavitron. Cavitron has a tendency, once you start to work, that aerosol spray just goes everywhere, blocks your line of vision, doesn't allow you to see when you're using your mirror. This kind of goes right into the area, focuses in on flushing that tissue out really well, breaks up some of that plaque and bacteria and all of that calculus that tends to form in and around those interproximals. And the best thing of all is patient comfort.
Is there anything you like least about it?
I think the only thing that I would say gives a little bit of difficulty to would be more the fact of how you actually attach the tip to the actual piezo unit, because of the fact that it tends to be a bit of a bulkier system, and you have to kind of, it's a ratchet system, so that it's a wrench to place it on. It tends to sometimes loosen a little bit as you're trying to remove this off and place it on. So that would be the only thing. I mean, but other than that, it's just knowing how to work it in order for it to stay on permanently. Same thing with the removal. Once you place it on, it has a tendency, it doesn't stay fully gripped onto the actual ratchet system. So it's just being cautious that you don't lose the tip in the process.
So overall, how would you compare it to the others?
I think it surpasses a lot of the other units that are out there. It definitely gives you much more control, ergonomically much easier on the hand. You're not feeling that tension with your fingers. It's smooth going all the way around. I can actually manipulate and not feel like I'm getting any discomfort. Patient definitely is not getting any discomfort as I work, and I'm still able to manage all around throughout both lingual and buccal without any discomfort for the patient. And that's the main focus for me.
And how does it feel for the patient?
That felt great. I didn't even feel like anything was being done. It was absolutely amazing.
Awesome.
And I tend to get sensitive, and it was not sensitive in the least.
The good thing about it is you can actually have it where you can change the actual amount of frequency that you're placing on it much readily and easier than if you were using the Cavitron, where you're actually using. So if I wanted to increase it, I could increase it very easily without having to go turning knobs, pulling switches, water delivery system. If I don't want the water, I could turn the water easily off. One less thing to worry about with patients who have a tendency to gag or have a sensitivity to the temperature of water. Still works just as well and effective.
So overall recommendations, thumbs up?
Thumbs up.
5
Double
stars?
thumbs up.
Double thumbs up.
Thumbs up.
Thank you.
You're welcome.